Good afternoon, and welcome to Mercy Health Muskegon's Healthcare Spotlight. This is your host, Katie. Each week, Mercy Health will bring you important and helpful information that guides you in becoming more informed and more involved in your healthcare decisions. Carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. Today, we're talking about the important topic of breastfeeding with Dr. Poortenga, neonatologist and co-director of Neonatal Intensive Care Unit and the medical director of breastfeeding medicine at Mercy Health. Thank you for joining me, Dr. Poortenga.
Thanks for having me. It's great to see you.
So we'll start off talking about some of the benefits. What are some of the reasons that people should breastfeed, that women should breastfeed?
Well, thank you so much for contacting me. Certainly, I think there's various different ways to look at the advantages of breastfeeding. They revolved from the benefits of breastfeeding, the protection it provides, the maternal benefits of breastfeeding, and actually the environmental benefits of breastfeeding. Does it make sense for me to go through each one of those areas for you?
Yeah, that sounds good. Why don't we start with the maternal benefits? What's in it for mom?
Okay, great. Well, when you're talking of breastfeeding for moms, the important things to go are as follows. For one, having breastfeed reduces your incidence of bleeding after birth. It actually has a rapider decrease in the size of the uterus. There's less menstrual blood loss and less anemia. There's increased child spacing, and there's an earlier return to pre-pregnancy weight. And then, very importantly, there's a risk in cancers, that being breast and ovarian cancers, as a result of breastfeeding. And this is all really well documented from a academic standpoint. They're clinically found.
Very cool. And where you had mentioned some environmental factors?
There are. We like to think of breastfeeding as lean, green, and clean through the academy. And we look at it that way because breastfeeding reduces the risk of obesity, the expenses related to feeding, the incidence of water and energy use, the production of waste pollution, and the reduction of bacterial contamination as well. That's what makes it lean, green, and clean. In general, breastfeeding families are sick less often and miss less work, and it doesn't require much energy for the manufacturing of creating waste or pollution.
Very cool. And are there some other additional benefits, too, for the child?
Yeah, well, of course, the benefits for the infant are really dramatic from my perspective. First of all, you can talk about what breast milk provides. Breast milk really provides all the necessary nutrient for a growing infant in the proper proportions. It's easily digested with a much slower incidence of constipation. Babies have healthier weights as they grow, and babies who are breastfed actually tend to do better in IQ tests. Additionally, breast milk changes with volume and composition with babies' needs based on the frequency of nursing of the baby and the frequency of the feeding of the baby and also the baby's age. So those are the things that are actually provided. Then you can talk about what breast milk production protects from. And what breastfeeding actually protects from is really a dramatic volume of issues. When you first of all thinking about infections in general, breastfeeding reduces the incidence of bacterial infections. There's a reduction of diarrhea or bowel infections, a reduction in respiratory and or breathing infections. There's a reduction in ear infections and urinary tract infections. Additionally, not just infections, there's also a reduction in allergies. And additionally, there's a reduction in diabetes, type 1 and type 2, and a reduction in cancers like lymphoma, leukemia, or Hodgkin's disease. And there's all academic data to support that. These are all in peer-reviewed journals documenting this being reduced by babies who are fed human milk.
Do they know why breast milk is such a superfood for babies?
Well, it's just found that from a nutritional standpoint, exposure to breast milk reduces encourages the nutritional advantages and also reduces the risk of artificial presentations. So it's likely related to both of those issues that contribute to the positive effects of breast milk. And the other element that's really interesting is the reduction in obesity. And that's largely a function of something that just can't be duplicated by formula, because it's not just related to the volume, but it's also related to the human body as it adjusts relative to the amount of breast milk fed by the fetus, or the baby, I should say. So as the volume that the baby eats increases or decreases, the concentration of the milk in the mom changes based on what the baby's taking in. So that's how it balances out the risk for obesity and adjusts that.
Wow, that sounds fascinating. So if you're a mom who's just given birth to a baby, for how long should you breastfeed? What are the recommendations?
Well, that's really interesting. There's different recommendations. There's two most notable recommendations. One is from the American Academy of Pediatrics, and actually one's the World Health Organization and UNICEF. They both have different recommendations. And so both the AAP and we'll say World Health Organization, which is WHO or UNICEF for short, they both recommend exclusive breastfeeding for 6 months. And that's, nutritionally speaking, the best direction for breastfeeding to go for a newborn infant. Then after 6 months, what the Academy recommends is that as solid feeds are introduced, that continued exclusive breastfeeding continues, at least for a year, and then for thereafter, as long as mutually desirable by the fetus and the mother, or the baby and the mother, I should say. So as long as that's acceptable to both the mother and the baby, it should just be continued for as long as mutually agreeable. Now, the World Health Organization and the UNICEF, which was the start of the Baby Friendly Initiative, we can talk a little bit more about that later, but their recommendations are the same, yet they recommend it for 2 years. So the World Health Organization and UNICEF recommend continued breastfeeding, the breast milk being the source of nutrition, and for it to continue for at least 2 years, or as long as it's mutually agreeable for the mother and the infant.
So what does exclusive breastfeeding mean, and what does that look like for a family?
Well, the exclusive breastfeed means ideally when a person is fortunate enough to be able, when the mother and the baby are fortunate enough to be able to do this, to actually only feed the baby human milk. And that's either milk at breast, or perhaps if the mother is working, then pumped milk that's fed by another person who's watching the baby, but otherwise all receiving maternal human milk.
Okay, thank you. And what are the rates of breastfeeding within our region or in our country or state? Are we seeing an uptick in that?
That's such a great question. And yes, you're absolutely right. Our country is seeing a higher rate of breastfeeding. As a community and as a country, really, there have been healthy people goals set by the government, aiming for goals that optimize breastfeeding rates for our country and then for our specific areas. And I can tell you things like the Central Disease Control Center's goal for the initiation of breastfeeding, and that means just starting breastfeeding. And the goal they're shooting for is about 81.9% for the United States. What I can tell you is that Michigan is doing pretty well. Our breastfeeding rates of initiation are right around 80.8%. It varies a little bit from county to county, but overall, Michigan is doing pretty well from initiation. However, what has gone down, and when there isn't great CDC data, is what's it like when a mom wants to breastfeed, but what are our statistics like when she actually leaves the hospital? How likely is she being to exclusively breastfeeding? Those numbers seem to be dropping dramatically to being more like in the 50th percentile. So a mom that initiates breastfeeding, by the time she leaves the hospital, about 50% of them are actually breastfeeding exclusively. The rest of those moms are introducing something else. And the goal for any breastfeeding at 6 months for the CDC is around 60%, but in Michigan, we're at about 50% with any, I'm not saying exclusive, which is the goal, I'm saying any breastfeeding at 6 months. Yeah. And so exclusive breastfeeding rates are really not well documented, but presumably not great at 6 months right now.
Wow. So you're saying that after people leave the hospital, they intend on keeping up with the breastfeeding, but then something goes awry in their plans and they're not able to complete that.
That seems right. There seems to be some challenges, whether it be in the community or in their own social context. And we can spend a little bit talking about what to me seems like perhaps one of the saddest parts about breastfeeding, which, for the reasons that we've already spoken about, seems to be a tremendous advantage for the baby, for the mom, for her environment. Yet it's a challenge, and it's actually a much greater challenge in different minorities. As far as the Caucasian community, breastfeeding is actually improving. Rates are getting better. There's better social support. There's better support in workplaces. There are ways we need to work on those things, but it seems improving. What is challenging more is minorities in our community, and that's for various reasons. If we look at African Americans, for example, the initiation of breastfeeding amongst African Americans is much lower than Caucasians. And we've looked a little bit at trying to understand what the reasons are for reduced breastfeeding in African Americans. And there seems to be a large component that's a function of what's acceptable from a cultural context within African Americans. And what it looks like is that even though moms, for example, necessarily want to breastfeed, sometimes either their family or their partner doesn't necessarily recognize the advantages of breastfeeding as much. So even a mom that may come educated and prepared to breastfeed, their context is not so acceptable and supportive, and that contributes to the less likelihood of being able to breastfeed in the African American community. And there's even more fascinating data among Latino families, because from an initiation standpoint, Hispanics are much more likely to breastfeed, even more so than Caucasians. However, the likelihood of breastfeeding exclusively is much less, and continuing breastfeeding at 6 months is much less. And it's interesting because that data gets really crazy because it varies from what country you're coming from. If you're Mexican, you're much more likely to breastfeed than if you're from Puerto Rico, for example. And then the support in your communities also varies geographically from what part of Latin countries you're from. But in general, they start really wanting to, but there's not enough support in the community to continue.
And so what would support, when you talk a lot about the support from your family, so what does support look like from a family? If you're the mom and you have a brand new baby and you want to breastfeed and you want to keep exclusive breastfeeding, what does that look like from the family standpoint?
And that's such a great question, because the reality is, why is it that there isn't the support that we need in the community? What, in fact, do we need to continue? And first of all, we want to just start with plain education and information. And a lot of women are going to their doctor's office and getting really great education and information, but their spouse or their mothers or their sisters, they're not getting that same education. So number one is a lack of education and information within their population. Additionally, sadly, there's some health professionals that weren't properly educated. So if you're trying to get the education and you're getting a little bit of loose education and you don't really feel like your health professional is properly supporting you, that can actually get a little bit frustrating as well. Additionally, and many people experience this, their environment at their workplace just doesn't offer the proper amount of support. So there's no proper place for them to pump. There's no place to bring in their baby, let's say if they're running a long shift and they could perhaps put their baby to breast. And the lack of knowledge and lack of support from their employers can exacerbate that as well. In fact, sometimes there's short maternity leaves. If you're newly hired, you might not even have maternity leave. That can exacerbate the likelihood of you being able to risk. And then, from my perspective, another really sad thing is the marketing. The marketing for formulas. That, to me, really exacerbates the likelihood of, this isn't going well, I'm just going to get some formula. Or even family or your partner saying, oh, honey, I can fix this. Let me just go get some formula. When actually we know that the human milk is the best strategy for the baby. So doing your best to optimize at least the volume of your milk that you can provide for your baby is just frustrated by those elements in your environment.
Yeah, for sure. So there has been, over the last several years, there's been introduction of legislation, such as now at restaurants, you're protected to breastfeed at restaurants in Michigan, whereas before you weren't about 5 years ago. And there's also about, with the Affordable Care Act, now through your insurance, you get a breast pump. Do you think that these steps are helping people be able to feel more comfortable breastfeeding, giving them the right tools to breastfeed? I mean, how is that important?
Well, I think exactly like you said, there's been a movement in that direction, but it's not all the way there. So there's no question that the efforts made by insurance, by Medicaid, by private insurance, and also the differences made in a social context, but that's forwarded by government to protect. It's great, but when you're dealing in a situation where you have paternal biases, or you have minority biases, or you have cultural or social beliefs that don't support it, a mother might still feel awkward, even though those elements are allowed. If it feels awkward to pump because dad just doesn't understand it and doesn't feel really supportive of it, a mom might be less likely to pump. Or if you're in an environment that has allowed for it by external forcing to allow for breastfeeding, yet someone doesn't feel comfortable to do it, it just doesn't work. So while the government can force some rules, until there's a social and cultural adjustment and perspective, it does put a lot of pressure on the mom, I think.
Yeah, definitely. And, other programs such as WIC, they provide hospital-grade pumps or pumps to rent for moms, to help instead of just handing over formula or giving,
Yes, you're absolutely right. Yes. And that's been a newer modification to WIC recommendations. But yes, they've become much more supportive and actually very supportive for moms that need supplementation, which is suboptimal but still necessary and helpful. And they actually give priorities and positive support and reinforcement of mothers who do their best to provide human milk. And that's been a newer direction WIC has gone, but it's very good and very supportive of moms who are trying the best they can to work and provide human milk, which isn't that easy.
No, it can be very challenging for some people. So how does Mercy Health, how do we help families achieve their breastfeeding goals?
Well, right now, I really like the fact that we've become moving on a continuum of becoming baby-friendly at some of our Mercy Health hospitals. And by doing so, we've followed the 10 steps recommended by the World Health Organization and UNICEF that makes our hospital a baby-friendly hospital. And in order to do that, what we've done is encourage the education antenatally. So before a birth, when a mom comes to a Mercy Health physician's office, they are introduced all throughout the pregnancy at various different stages of the pregnancy to what advances breastfeeding, what prepares a mother for breastfeeding, and what supports a mom from breastfeeding. And so that's wonderful because mom get the thought of breastfeeding, the desire to breastfeed, and head to the hospital with that notion and the opportunity to discuss with their spouse, perhaps even bringing their significant other to a doctor's office to discuss that. Then once we get to the hospital, we've tried a lot of new strategies. Some of the ones that we've found most effective is a rapid desire to place the baby skin to skin with a mother right after birth. That increases the likelihood of good milk supply. In addition to that, what we do that's very progressive is if a mother is somehow not available to go skin to skin, we do two things. Number one, we have the mom pump as close to 1 hour after delivery as possible to encourage her milk supply, either hand pumping or pumping with a mechanical pump. And then additionally, if the dad's available, we put the father skin to skin to the baby, which meets the emotional standpoint from the baby and also really improves the bonding of the father. Then after that, we have strong lactation support to support the process of various stages in lactogenesis and the improved production of breast milk from the mother. And then also, we encourage through our pediatricians and through our lactation support a really close observation of babies that are born, for example, kind of what we call late preterms, that are maybe born somewhere between 3 weeks early or less, that struggle a little bit with breastfeeding. We offer opportunities for following up early, and then also extensive support with our lactation support system in our Mercy Health hospitals to encourage that breast milk supply.
Wow, so it sounds like we do a lot of different things all along the way, from before birth to after birth, just to try to keep people in the loop and keep people in the know. And I like the, you mentioned about bringing your partner to your prenatal visits. Is that something that you'd recommend kind of throughout, just to keep everybody on the same page?
Absolutely, Katie. You know, what we do know is the closer your partner is involved in assisting you with your breastfeeding, the more likely you are to not only just initiate it, but to continue it and to do well with the continuation of breastfeeding. So yes, whenever you have a partner involved, the more knowledgeable the partner is, the more cultural biases are withdrawn or educated to that partner, the more likely that partner is to contribute and support.
And great. And I know that at Mercy Health, we have support groups located in both Grand Rapids and in Muskegon. And we have them, they're free. You don't have to register. You can walk in. And so you want to tell us a little bit about what someone could expect during a support group?
Absolutely. Well, and thank you for bringing that up, because we did talk about our support antenatally, or before a baby's born, and then while the baby's born. We didn't talk that much afterwards. And really, as a physician or as a lactation specialist involved with a baby that's breastfeeding right after birth, we know a baby that's lost a lot of weight, that mom hasn't started her second phase in breastfeeding, they're at higher risk. So we want to do, and what we're leaning towards, is closer and earlier follow-up. Not only being followed up at the baby's pediatrician and the obstetrician's office, but instead by our lactation team. And we have a wonderful lactation team. An outpatient consults are allowed. We have a team of several international board certified and clinically board certified lactation consultants that are all available through our hospital. We have a breastfeeding mothers meeting at Mercy Health on Mondays and Fridays, 6 to 7:30, and then Fridays 3 to 4:30, and they're at our Wegge Institute. And then we also recommend a La Leche League follow-up, some opportunities for lactation follow-up at other hospitals. And then what I thought was just a wonderful opportunity is an opportunity for Strong Beginnings. And the Strong Beginnings program is really, really unique and special in Grand Rapids. And we love to gather people from Muskegon area as well, because it's a specific breastfeeding support for women of color. And it's an opportunity to really discuss with people who understand the cultural challenges, the challenges of the person you love, not understanding enough about breastfeeding, and discussing that amongst themselves. And that's an event that happens at City Life Church on Wednesdays in Grand Rapids, Michigan, but we'd love to have people from everywhere. And then there's this Milk and Cookies Sharing and Learning breastfeeding event in Greenville. And then we also have opportunities for breastfeeding locally at Hackley Hospital on the labor and delivery unit on Mondays from 5 to 7 and Thursdays from 11 to 1. There's opportunities for breastfeeding. We actually have an information number there, 231-727-5548. We're happy to return your call and direct you to the most optimal opportunity for breastfeeding support through their hospital. And they also sometimes offer some walk-ins, which is pretty incredible at Muskegon. But if you go through that number, that's how they can arrange it best.
And you mentioned a term, lactation consultant. What does a lactation consultant do?
Well, that's a great question. A lactation consultant is a certified individual who is either internationally board certified or nationally board certified, who has an education that can help in a very, in not just intuitive, but experienced and educational way to encourage lactation specifically. These are people that are very much focused on how a baby latches on, how the transfer from the milk happens for the baby, and how the mom herself is feeling, how her tissue looks, how she's hydrating, how her breasts, not every breast looks the same and is tolerating breastfeeding the same. And that's really a way to focus your energy on just that area of your raising of your baby and helping you and encouraging an individual with those areas of the breastfeeding.
And so if a mom is struggling with breastfeeding, with a baby latching on, and just other issues too, do you recommend that people can just call lactation consultants just for any assistance?
Absolutely. I think being seen by a lactation consultant is really a wonderful way to target those problems, and it doesn't take a major problem. Even a latching problem early on, or perhaps you're worried a little bit about the shape of your baby's mouth relative to your breast tissue or whatever. But yeah, lactation service. And if there's any question about how being connected with lactation in your community, go to your pediatrician's office, and your pediatrician's office will help to direct you, or your family practice office, or your OB. If you go via physician, if you don't feel comfortable knowing where to source your lactation individual like we recommended, that's really an ideal way to approach it.
Very cool. Yes, and also people can also visit mercyhealth.com and find out more information about breastfeeding support and breastfeeding services as well.
Yep.
So, and recently we came across an interesting story about some pushback from people who claim that the benefits of breastfeeding may be overstated. So, from your point of view as a healthcare professional who works with lots of sick babies, I mean, what are some of the reasons that the rationale that they may have behind this, or what are some reasons that we have that we say no, that the benefits of breastfeeding cannot be overstated?
Yeah, that's such a wonderful question, and I think such an important question for the community. Basically, we practice from the basis of evidence. I'm a scientist. That's how I started out doing what I want to do, being a physician. Now I work with just preterm babies. Certainly the advantages of human milk in the context of preterm babies is strictly evidence-based. But in addition to that, everything else that I described regarding the benefits of breastfeeding are all endorsed through the Academy of Pediatrics and the evidence behind that. So while there are some arguments, the reality is everything we've discussed is evidence-based. When you talk about higher IQ and the longstanding nature of those particular findings, there is some debate in the literature, but overall, being engaged with your mom and having human milk certainly demonstrates the best intellectual advancement early on.
Very cool. Well, thank you. Are there any final takeaways that you have for our audience that we haven't addressed?
Well, Katie, I think you've done a wonderful job addressing from my perspective what are the critical issues with breastfeeding. But in addition to that, and perhaps just reiterating what we said, recognizing it before you actually have your baby, your desire to do it, once you've had it, getting all the support you need to continue that, and then to really do your best to modify your family, the cultural perspective, the perspective in different groups, and the way to be supported with breastfeeding in your individual world and trying to get support in that.
Well, very cool. Thank you so much for your time today. I know that I've been personally helped by lactation consultants and breastfeeding support groups, having had 2 daughters myself, so I definitely appreciate your willingness to come and talk to us and support a community as we try to move forward and improve our breastfeeding rates as a community. So thank you so much, Dr. Poortenga.
Thank you so much. It's definitely something I'm a strong believer in, and I support as best I can.
All right, thank you. So today's broadcast has been brought to you by Mercy Health Muskegon. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.